Welcome to GRTV's MPO Showcase. I'm Julie Way from the Community Media Center. Today we'll speak with Susan Henning and Belinda Robinson, who work with the MOMS program at Spectrum Health. Welcome, Susan and Belinda.
Thank you for having us.
Sure. We're excited to learn about your program, so let's jump in and just hear about what the MOMS program is.
Okay, great. Well, I'd like to start with saying that MOMS is an acronym, and it stands for Mothers Offering Mothers Support. And we'll talk a little bit more about the services, but I do want to talk about how we fit within Spectrum Health. We are part of the Healthier Communities Department, and that department is responsible for a $6 million community benefit that Spectrum provides to our area every year. And they help support our program as well as other programs that address the needs of the underserved population in our community.
So there's several other programs, but MOMS is who you're working directly with as one of those outreach programs. So tell us a little bit about what the goals are to help moms do.
Sure. Well, the MOMS program is actually part of a statewide network of maternal infant health programs. And we all work towards helping low-income women have healthy pregnancies, healthy babies, and to be good parents. And our services are all geared towards those goals. Ultimately, we want to reduce infant mortality in our community and in our state.
Very good. So some of those goals specifically that you offer through these services are to help them enroll in Medicaid, and can you talk a little bit about what those type of services are?
Sure. So first of all, women have to be Medicaid eligible to participate, but many times they haven't gotten on Medicaid yet. And navigating the system through the Department of Health and Human Services can be really challenging. So we feel like we're experts at that system navigation. We help them get on Medicaid, we can help them enroll in WIC, we help them find community services for clothing, furniture, baby supplies, all the kinds of things that they might need to provide the best thing they can provide for their babies.
Very good. So really just helping them to access these resources that already exist in our community, but it's, like you said, can be really hard to navigate.
Yes, and a lot of times people don't know what they're eligible for or what's out there.
Exactly.
Yeah.
Don't even know that it exists.
Exactly.
So how does your program accomplish these goals as you're helping, really reducing that infant mortality rate is your main goal? So how are you doing this?
Sure. Well, our services are provided by nurses, by social workers, we have dietitians, and we have community health workers. So it's a diverse team that will meet with our participants and try and address whatever needs they have. In some ways, we're an extension of the physician's office because we provide education like the physicians do, but we provide more of it, and we provide it in people's homes where they're comfortable and they're not rushed by a 15-minute doctor's appointment. So that education might be about prenatal care or about problems in pregnancy. It's helping them prepare to breastfeed or potentially learning skills to prepare them for a new baby. So it's really broad, and a lot of it is based on what they need and what we kind of determine their risks are.
Sure, and what a great thing to be able to provide that in the home. Like you said, it's where they feel comfortable and can maybe ask for more things that, they might not be able to in that rushed amount of time like that.
Exactly, yeah.
Yeah, so Belinda, you are one of the community health workers. Can you talk us through how this visit type of works in the home?
Sure. So when we go into the home with our clients, the first thing we do is we reduce the barrier between ourselves and the client. And we help the client to recognize that we are more like that support system, like that big sister that they may not have. Or a lot of our clients are here by themselves and going through the pregnancy without a partner, without family members, or are estranged from their family, and they need that extra support just to reduce the barriers of stress itself that comes along with pregnancy. So our goal, first of all, going into the home is to just reduce that barrier between ourselves and the client, reminding them that we're mothers, most of us are mothers ourselves, who have gone through the same stressors, who have also participated in different programs and support groups that have helped us come along the way in giving our babies the best care as well. We help to reduce the barriers of transportation, the barriers of access to health care that some of our parents have. And that also helps them to recognize that we're there for them, to give them the best care, to help strengthen their families. We also try to make sure that the clients recognize and understand that we're not there to tell them the all, we're not the experts at everything, that we put them in the expert seat, that they're the experts of their family, and that what we can do is help them strengthen from where they're at right now to get to a better place of health and support the family in a healthy baby outcome.
Wow, you're really empowering them. That's
Yes.
such a great thing.
Yeah. Yeah. Our goal is to educate, empower, and to encourage them to be the best them.
That's really inspiring, I think. And you've got that personal experience, you're able to connect with them in that way. That's really
Yes.
great. And I understand that you have a patient story that you're going to share with us, so we'd love to hear about that.
This is a patient I've actually worked with twice throughout the pregnancy. 2 times. She had a baby the first time, and the first time she really had feelings of sadness. She wasn't ready for a baby. Her and her partner, neither one were working. They were staying with his aunt. The house, there was always people coming in and out of the house, so that brought more stresses on her, not feeling that she was in a safe place. She wasn't making it to all of her doctor's appointments for prenatal care, and she just didn't know what direction to go in. So myself and the nurse that was on the team that I was working with, we were able to really just encourage her how important it was to get the prenatal care, and that without having that prenatal care, she was really at risk of premature labor and risk of having a baby that was premature and with some barriers to healthcare itself. And so she then began to understand and trust us, and that was the biggest thing, is helping our clients to trust us. And so what we do to help them trust us is we stop thinking about what we think is best for them and start encouraging them and empowering them to understand what they feel is best for them. And so this particular client at the time, she started going to all the doctor's appointments. She began to even take the bus to the doctor's appointments instead of waiting for other people. So she reduced her own transportation barrier. She began to believe that she could do it, that this was important for her and it was important for her to have a healthy baby. And once she realized the importance of having a healthy baby, everything else that was a barrier to her began to fall to the wayside. She began to get better housing for herself. She got a job after she had her baby. Her partner got a job, and they both are working today still. They're in their own home today. They now have another baby, and when they became pregnant with the new baby, they called back for us, the same team, to work with them and to bring that support in, because they wanted to be in a different spot with their new baby than they were when they were with the first baby. And now she's gotten her driver's license and ready to purchase a car this year. He's still working. He's been working for over 6 months, and he's someone who never really thought about working before. But the encouragement that our team brought in with them and them believing in themselves has gotten them to a point to where they want even more in life. So.
What an amazing story, and you'd think it's support in this one area, but as you've shown, that really just went throughout their lives, and they've improved their lives for the better.
Yes, and our goal really is to work with the whole family. So we may go in and our goal is the mom who's pregnant to have a healthy pregnancy outcome, but we know in order for that to truly happen, the whole family has to be strengthened. And so we really go in to work with the whole family and encourage and empower that family to work together.
Very good to know. So a clarifying question about the eligibility. I know you mentioned they have to be Medicaid eligible, but do they need to be pregnant, or they already have the child? What does that look like?
So we really have 2 enrollment points for the program. One is during pregnancy, and then the other is after the infant is born, anytime up until the first year of life.
Okay, so a couple different entry points, which is
Yes.
always great.
Yes.
And part of what you do too is bond with the babies themselves. Can
Bonding,
you talk to us?
that's
about
one of
that?
my favorite parts. That's one of my favorite parts, is bonding with the baby themselves. With bonding with the baby, it's nothing like seeing that new baby, first of all. As soon as you see that first baby for the first time, it's like the mom, especially if you've had the mom through pregnancy, you walk through the pregnancy with the mom, it's like your baby that you're seeing again for the first time. And so coming in and just reassuring the mom and role modeling with the mom what to do to take care of her baby, tummy time, safe sleep, baby sleeping on the back, that is one of our very key educational points. Checking to make sure that mom understands and teaching back, what does that look like, for you? doing the tummy time and creating activities with mom that she can do with baby to help baby develop when we're not there, and always making mom the educator of her child. And so we do a lot of role playing with the baby. If it means getting down on the floor with mom as the baby begins to grow and develop, and showing her how to help baby start learning how to roll over or to get on their knees and on their hands to start crawling. All of that is a part of who we are and what we do, because we want mom to know that once we're gone, that she has the skills that she needs to help continue to help baby grow. So bonding with that baby is like just taking that baby on as if they're your own child, and looking at the mom's heart and embracing your heart with mom's heart to care for the baby.
Wow, there's just so much of yourself that you put into this work.
Yes.
And that's really great. So if moms want to get into the program, talk to us a little bit about how the referrals work and how else they can connect.
Sure. Well, most of our referrals come from Spectrum Health physician offices, but that's not required. Individuals can call our phone number, they can send us an email through our website, and we take referrals from anywhere. A physician order isn't required. And in fact, we're seeing quite an increase in referrals by word of mouth. So participants who have a friend who's in the program or a cousin will oftentimes call us themselves and ask for services.
So you're really having some impact just
so.
by that growth through word of mouth. Very
Yes.
cool. Well, what else should we know that we haven't talked about yet?
I think one of the things is some of the partnerships that we have. Like we partner with Strong Beginnings, which is one of the grants that I work with. We work with Family Futures, with different places like that in the community. We just wherever we're needed at in the community, we do a lot of outreach and connecting with our community-based programs and things too. So anywhere that we can be, that we get visible and that we can talk to a mom. If we're in a grocery store and we see a mom, we're standing there talking to them and ask them what their support system looks like and how we can be of support to them. So that is one of the greatest things that we do, is just connect with our community.
Yeah, very great. Love to hear that connecting piece.
The other thing I'd like to add is that there are actually 7 maternal infant health programs in Kent County, and women can participate in any one. 3 of those programs have community health workers like Belinda through Strong Beginnings. In addition, Spectrum Health Moms program is the only one in town that community health workers are available for any client, regardless of eligibility for Strong Beginnings or not. So I think that's what makes us stand out from the other maternal infant health programs.
Yeah, very key. It's great that anyone can access that service.
Yeah, it really is. The mentorship that comes with a community health worker is really unique, and it's something that we really embrace providing to the participants in our program.
They bring so much experience and obviously passion for the work.
Yes.
So
Yes.
that's a really great thing.
Yeah.
All right, well, we're out of time for today, but thank you for joining us and for letting us hear more about the MOMS program. You're doing some really cool work in our community, so thank you for that.
Yes, thanks
Thank
for the
you.
opportunity.
Thank you.
Thanks for joining us today. We'll see you next time.